All right. Welcome, everyone. Thank you for being here. We're going to give people a few more minutes to join, but I do want to kick us off on time, acknowledgement of everybody's time and space that you provided to be with us today. So first, I want to say thank you so much for joining our event. I'll get started by quickly introducing myself. My name is Daisha Reed. I currently serve as the Vice President of Government Growth here at Unite Us, which means that I get to advocate for policies that invest in communities all over our country and also work with our government partners to operationalize some of their programmatic objectives using Unite Us technology. So I am super excited to be moderating our panel today. And before we jump in, just want to share a quick note that we are going to be monitoring the chat. And throughout this panel, if you have questions that you want to submit through the Q&A button, please do so. And we've reserved some time at the end of the panel to try our best to respond to as many questions as we can. So to get us started, I'm really excited and personally honored to be facilitating this conversation on child well-being. This is a topic that's really personal to me as a single mother. I have the benefit of a wide network and opportunity to provide for my daughter, but it's still challenging for me to navigate some of her healthcare and developmental needs. And so I think a lot about how we can support better systems around children and families as families are navigating a range of social and economic needs. Professionally, before I came to Unite Us, I actually did this, my work at the Children's Defense Fund for many years, working on policy issues, and then working in my home state of Rhode Island in various roles. But one important to this work was around being the director of the Rhode Island Children's Cabinet. That's a cabinet of policy directors of agencies, that all provide services or programs for children and families in our state. And I can't tell you how often we would try to come together across departments and try to center families. Think about how can we make our systems and our programs more family friendly so that it's not so hard to navigate between programs and to find ourselves kind of siloed across service systems that are meant to be serving the children and families in our communities that we want to be able to support and be successful and really promote their well-being. And so here at Unite Us, that's really been the history of this company, starting first with veterans, then with more in a healthcare space. We've consistently asked ourselves, how can we improve the systems around the individuals that we're serving so that access to social services and community-based resources can be easier and families and children and other individuals and communities who need help can get it. I want to quickly share, before we jump into our incredible panel, a slide that talks a little bit about some of the really encouraging outcomes that we see from some of this work in the healthcare space. And as we see these outcomes in the healthcare space, how we can think more about what we can do to also be really improving child well-being. So hopefully you all can see this slide. This slide outlines what we see for children and families on Medicaid across the country in terms of real impact. We know that our country is an outlier when it comes to maternal health, but we also know that community-based care coordination that helps mothers and small children access the social and economic needs that they address the social and economic needs that they have, can really help. And with our partners in Sarasota, Florida, at the Sarasota Memorial Hospital, we saw earlier this year really significant reductions in the likelihood of readmissions for postpartum mothers, for both postpartum causes and also all causes. So as we think about how can we help specific populations of children and families, we can get tight on what are those social needs that are most likely to be improving outcomes for children and families, and learn from lessons like this to see really encouraging improvements in health outcomes. At a more scaled level, we see additional improved real impact in the state of North Carolina, where there's a Healthy Opportunities pilot funded by an 1115 Medicaid waiver. It's really providing the nation's first kind of comprehensive program to provide non-medical social services, housing, food, transportation, other interpersonal safety services to Medicaid enrollees. And early evaluation results on that work demonstrate really significant outcomes, including reductions in emergency healthcare utilization and lower cost of care for members. So as a company, as we're seeing how addressing social needs in a comprehensive way and really focusing on whole person care can support families on Medicaid, we increasingly think about not only trying to improve those health outcomes that are measurable, but also improve child well-being. And we know that there are systems. I think a lot about my days on the Children's Cabinet. Often it's about healthcare, it's about schools, it's about child welfare systems, trying to find more ways to say it is possible to enable collaboration effectively that centers families between departments and across communities. And I regret that at times when we were working on the Children's Cabinet work, in my own experience, our conversations would devolve to how do we do data sharing? We'd be around tables for a long time. This is important work to focus on, but oftentimes meant significant delays before families were able to really have support that met them where they were in their communities. And so one of the things that gets me really excited about this panel and about Unite Us is that there are tools that technology tools and community-based resources that can center families while we figure out a lot of this additional work that can streamline systems and bring families together. And we can keep child well-being and child safety as that North Star as we're doing it. That's really our goal at Unite Us, to bring technology solutions that help to modernize connections to social care and ultimately reduce the impact of siloed systems on families who need support. So today we're going to talk about the policies, the practices, and the technology that communities can start to think about using collectively to really bring these sectors together in the spirit of improving overall child safety and well-being. And we have a fantastic panel to help us think through this. We've learned a lot. We're still learning a lot. And I want to start by providing each of our panelists with an opportunity to share where they're coming from, who they are, excuse me, and also where they're coming from. So I'll start with Katie Rollins, move to Liz Thompson, and then ask Katie Keating if you'll please, again, introduce yourselves, where you're coming from, and then we'll jump into our conversation. Katie?
Great. Hi, my name is Katie Rollins. I'm a policy fellow at Chapin Hall, and I'm very happy to be here today. I work with jurisdictions across the country, particularly child welfare agencies, but across the health and human services spectrum on a range of policy and implementation projects designed to promote child and family well-being and to really target the caregiver to promote family well-being. And with that in mind, we see a great need for the interagency collaboration that we were just hearing about. So very happy to be here. And with that, I will pass the baton to the next panelist.
Hi, my name is Liz Thompson. I'm a parent resource specialist at the Family Resource Center. We work with families in many different capacities. We also work with community-based organizations, large organizations such as child welfare, behavioral health and recovery, the local schools in our county, and local nonprofits as well.
I just want to thank Katie and Liz for joining us as well. Hi, everyone. My name is Katie Keating, and I lead some of our customer-facing technical teams here at Unite Us. I have been working in sort of child and family services from a technology perspective for the majority of my career, really focused first at the state level, and then really seeing the effect that communities could have in supporting programs to really provide community-based wraparound supports and make sure that people are really getting connected to the programs and services that make a big difference in outcomes for them. So Daisha, I'll pass it back to you.
Thank you so much, Katie. And really excited to have all of you. Thank you so much. Katie Rollins, I'm going to start our panel discussion with you. When we're talking about how to support child well-being from a policy, practice, technology perspective, I want to start a little bit with just some of the trends in child welfare and child well-being policy that you guys track at Chapin, and how you see that policy landscape kind of evolving towards community-based prevention models.
Yeah. First, I would just reframe a little by highlighting that we can't promote child well-being without promoting caregiver and family well-being. As we know, many families are living on the edge of economic scarcity, They're hustling to pay for expenses and to avoid the next bill or cost, and doing everything that they can, just like any parent does, to make a nurturing world for their child. And living in this condition can really tap caregivers' mental and physical capacity to an extreme level. At the same time, as a country, historically, we have failed to invest in sufficient social services. In addition, there are various layers of red tape that can make it hard to access even what's there. And some of that is lack of visibility of services, lack of coordination between agencies. And that can really make help out of reach for many families in need. So my work centers primarily on child welfare, which is a system designed first and foremost to address child neglect and abuse. And we see that far too often families end up in contact with child welfare when their well-being needs, so to speak, economic, mental health, childcare, for example, go unmet. And a crisis occurs or family conditions spiral as a result. The good news is, as we've been alluding to, that there's a growing consensus that we really need to fill these gaps and offer these economic and human service supports that are so needed. And indeed, we're seeing a shift in policies across the sector, which is exciting because I think these policies could stand to shrink the child welfare system while also supporting children and families in a way that's more humane and less costly than child welfare obviously is able to provide. So just a few examples of key policy shifts, knowing that we can't touch on everything. First, again, just because I am really focused on child welfare, I have to mention that historically, child welfare has been focused on investigations and foster care. And it's increasingly in the last several years really shifted to a focus on prevention. This started in 2018 when the Family First Prevention Services Act passed, which changed how jurisdictions can use Title IV-E, which is essentially the primary funding stream for child welfare, federal funding stream. In the past, it was restricted almost entirely to use on foster care related expenses, and following Family First, it could be used toward prevention services, specifically evidence-based prevention services to prevent children from entering foster care. And it was a real pivot for the field because with the federal funding, suddenly not only did jurisdictions have funding to fund prevention, but they turned their attention to prevention and they began to view it as essentially, although not technically a mandate of child welfare, something that they needed to do. Moreover, since 2018, through the pandemic and the Black Lives Matter movement, child welfare has continued to move farther upstream, thinking, that to wait until a child is on the precipice of foster care to put prevention in place is to wait too late. And with that in mind, many child welfare agencies are really trying to look left and look right and know who their partner agencies are, link arms with them, understand the community-based prevention services array, fill gaps in that service array, and make sure that families have the supports they need. To that end, actually 20 states now have been approved to use Title IV funds, not just to prevent foster care, but to prevent child welfare involvement. So to fund community-based services, which is a really exciting transformation. Beyond child welfare, in the broader health and human services sector, there's also momentum for this change. This can seem like a yo-yo, that things go back and forth over the years, but we are seeing a broader trend. We're seeing a shift in thinking. The role of government is increasingly to robustly support families and to help them thrive. Although it's not specifically a service or a community-based service, I think the most clear indicator of this shift in thinking is in the area of paid family leave, because the change has been particularly significant, particularly pervasive and recent. So right now, 13 states and Washington, D.C. have enacted mandatory paid family leave systems. And I think 8 states have voluntary systems that provide family leave through private insurance. And importantly, most of these were enacted in the past decade alone. So just sort of evidence that there is a shift happening and that change can happen. Another example I just want to provide is that jurisdictions are increasingly recognizing that addressing economic hardship can be a strong first-line strategy for promoting family well-being and preventing child welfare involvement. So myriad states, ranging from Kentucky to Indiana to New York, are experimenting in different formats with providing flexible funds or direct cash transfers to families at risk of child welfare involvement. Briefly, Medicaid innovation has been accelerating. States are increasingly leveraging Medicaid dollars to address social determinants of health, such as housing and nutrition, through a range of means. Some states have redefined medical necessity, which is sort of like the threshold for receiving reimbursable care, to allow people to receive mental health services in a more preventative manner, absent a diagnosis, for example. The examples are really far too myriad to list here, but I encourage you to check out Chapin Hall. There's a Chapin Hall resource called Meeting Family Needs that goes through a huge range of these sort of system shifts in policy.
Awesome, Katie. Thank you so much. Katie is a leader at Chapin Hall, and they as an organization are leaders in helping partners across the country rationalize so many different layers of policy change. You're describing federal level policy change, local, county and state policy choices, and then across a range of different systems. You mentioned Medicaid, you mentioned child welfare, you mentioned cash assistance and other benefit support. At a micro level, Katie, as you guys are advising, how do you see some of these federal, state, and local policies translating into initiatives in communities? I think that's what we want to talk about today, understanding this shift is happening in terms of an acknowledgement that there is value in investing in prevention and supporting upstream social needs and economic needs for children and families and caregivers, as you mentioned. What does it look like when you guys are working with partners across the country in communities?
Yeah. I mean, I think the first thing I would just say is to take a step back and note that many of these federal policies we're talking about have latent opportunities in them, whether it's Medicaid or 4E or TANF. And the way a state plan is structured determines the degree to which those opportunities are fully taken advantage of, right? So if you are sitting in an agency that is not the 4E agency or not the Medicaid agency, not the TANF agency, that doesn't mean you can't reach out to your partners and talk about how you could leverage that funding stream and the tools therein to achieve a set of shared goals. For example, I know that Oregon has a Medicaid 1115 waiver that targets families at risk of foster care. And when I spoke to some of the leaders in Oregon's system who actually initiated that partnership, it was remarkably intuitive how they initiated the partnership. They said, well, I called them and we set up a meeting and we talked about who we serve and what they need. And lo and behold, there was a lot in common. And this incredibly innovative Medicaid waiver came out of it. It's not always that easy, but I do just sort of want to advertise that there are probably more opportunities there than you know. With that in mind, I think I want to sort of highlight two things we're seeing as trends on the ground. One is back to economic and concrete supports. Ample research has really shown that economic shocks in the lives of families are strongly associated with increased risk of child welfare involvement and child protective services and maltreatment, not to mention a range of other child and family well-being outcomes. So for families who are low income in particular, experiencing material hardships, this could be medical, food, utilities, housing, is associated with an increased risk for both neglect and physical abuse investigations. And there's been ample evidence of this in the literature for years, and Chapin Hall has sort of called the research and pulled it together and begun communicating it because it points to a clear policy direction that hasn't always been clearly articulated. So, while the evidence-based programs funded through, for example, Family First remain a really important approach for families needing more support, addressing economic hardship can be that really important frontline strategy. So just an example of that is Kentucky provides up to $1,000 in flexible funds to meet the concrete needs of families receiving prevention services. So this is families involved in child welfare, with up to an additional $4,000 available for families with active CPS cases. So just really important that Kentucky is proactively acknowledging the connection between economic shocks and child welfare involvement. Similarly, Indiana's has an intensive family preservation services program that actually centers concrete supports to families. And evaluation data has shown that it actually reduced repeat maltreatment in both case and child levels. And importantly, it reduced racial disproportionality measurably. I think the other innovation that we're seeing really a groundswell of is what's called warm lines. So while child welfare currently receives referrals through a hotline whereby maltreatment is reported or suspected maltreatment is reported, leaders are starting to envision the idea of a warm line, which is a hub for referrals and also more hands-on navigation that can be accessed outside of these deep end systems like child welfare. And they could be used by helping professionals who are helping families or by families themselves. And while the term warm line sort of implies a phone line, the core components actually could include a phone line, a call center such as 211, and also could have at its back end a closed loop service referral platform similar to Unite Us, which families could log on to themselves or the helping professionals could use as their sort of database. In addition, ideally, such a warm line would have community locations like family resource centers or community action centers that families can walk into for navigation support. And we're seeing that proliferate right here where I'm located in Washington, D.C. is one of the best examples of a child welfare and Office of Unified Communications warm line. But there are others throughout the country as well.
Awesome. Thank you, Katie. I think it really helps to hear how these the intent of key policies can get translated into programmatic and objectives and be operationalized. And I heard you mention Family Resource Center. So Liz, I want to come over to you. You're at the Family Resource Center in Merced County, California. And I'm hoping you just start by giving our audience a little context on what happens at your organization and what does it look like for you on the ground?
Yeah, so we have a lot of programs here that we offer. We really focus on working directly with the families. We also are constantly connecting with new organizations, whether it be nonprofits or as people change over from the child welfare department and the mental health departments, we like to always keep in contact just to keep that line of communication open to better help our families. So one of the biggest things that we do here is we offer parenting classes, and we have 4 curriculums for that. We have caring for children who have experienced trauma. We have positive discipline and nurturing parenting, substance abuse treatment and recovery. We just got certified in the Triple P approach. And so with those classes, we work closely with the child welfare department. We get most of our referrals from the parents who have lost custody, who have maybe they're on the verge of losing custody. And we also get referrals from the schools for parents who are struggling with children who are having behavioral issues. Maybe they have a diagnosis of autism or other things, and they just need a little help with parenting and just trying to navigate through that. So that is our biggest program. The next one we have is a redirect program, and that is specifically for youth who are first-time offenders. They're on probation. Maybe they're not quite on probation, but they're heading that way. They come for a month for 4 sessions, and they learn from organizations who offer programs for them. So many of these youth, they don't have the family support. maybe they come from generations of gang members or substance abuse. And so for them to come in here, what's offered for them in the community, and that they can leave our little town and go and spread their wings, it's just a great program for them. We also have a program called Supportive Ongoing Services, and this we work directly with the schools. Mostly our referrals come from the schools. And this is for students who are school age, so anywhere from TK to high school. They could even be 18 or 19 as long as they're still enrolled in high school. They come with the referring party. The family comes, I'm sorry. We don't prefer the student to come because we don't really want to discuss what's happening, because sometimes youth feel bad about themselves, right? So we want to make up a plan of how to help them. And that's our goal, is to keep them out of maybe getting on probation or losing all these years of their education because maybe they have a diagnosis that wasn't found when they were younger. And so that is the goal of that program. We also are bringing the Lisa Project. I don't know if anyone's familiar with the Lisa Project. It is a really awesome, it's a heavy experience. However, it is a walkthrough of different child abuse scenarios. We did bring that to Merced County last year in partnership with another town. And so we decided we want to do that here because most of our child welfare reports have a lot to do with child abuse. And substance abuse and how that affects our children. So we are bringing that here. We should be launching that this fall. So we're excited about that. We also have our FRC strategic plan. It's a family resource center plan that we're working on with a certain area of town, which is more of the challenged area because there's not grocery stores. The accessibility in that town just isn't, or in that part of town just isn't there. And so we want to bring awareness to the city and the county to start bringing more resources for those families over there. And so that's what we're working on right now, specifically resources for unhoused families within Merced County. And so that's been a lot of work because, as we all know, with rising costs, many families, they can get into a place, but can they sustain it? Can they continue living there and afford PG&E, food, rent, all of that? So we're trying to find ways to communicate with organizations locally so we could all work together and create like an asset map of what we need, what we don't have, what we do have, and then kind of have like a map of how families can navigate that. So yeah.
Incredible, Liz. That's such a wide range of just innovative and hard work. So first, thank you for what you're doing. It's fantastic. I appreciate you sharing it. I heard you talking a little bit, you got as a family resource center attached really to the school district. You said a lot of your referrals come from schools, and this is where kids and families are a lot. You're dealing with and providing responsive programming for a range of issues, access to affordable housing, substance use, maybe issues around abuse and neglect. And so it's not just school related support, right? It's robust and responsive to the things that you're seeing in your community. How do you guys think about trying to get, as a service provider and as a resource, getting further upstream? Are there initiatives that you've prioritized around prevention or early intervention that are coming, or that you found success with to try to get it an earlier stage in a family's experience potentially?
So with that, we have found that a lot of families, because we're under the County Office of Education, sometimes they don't feel like we're approachable because there is a fear there with some families. They're scared of the schools, or sometimes they associate things happening at home. What if the teacher finds out my kids get removed? I can't trust anyone. And so really we're just getting out there and we're communicating with people. There is only 4 people in our office. And so it's interesting how we make it work, but getting in there and communicating with mostly community-based organizations, the nonprofits, because they're the ones who have the trust of the people in the community, as well as Unite Us. We've worked really hard with getting people into the platform because it's so easy. And I think because we don't have that many people here, we can send a referral, even though that organization may be 5 blocks away. sometimes it's hard to connect. And so getting that referral in and seeing that that person accepts it right away, we see notes and we communicate so easily that way. And so I think that's our long-term goal, is to get as many organizations into the platform, and that will help everyone to communicate faster, easier, as well as the families getting the help that they need, because we can track it. If we're sending families here and there, places move, they lose funding, phone numbers change, and families may have language barriers. There's all kinds of things that maybe they have anxiety, they have fear, they don't have a car. And right now today it's going to be almost 100 degrees outside. So we really want to make it the process easier. And so that's our goal, is turning back to Unite Us and trying to just talk people into, hey, you've got to join this platform because it's real time. It's how we can communicate and help as many families as we can.
It's really helpful. Thank you, Liz, for sharing that. And you brought us to, from thinking about policy to practice, use of technology. And that's what I shared. I'm really excited to talk through with as many partners as we can, so we can move into that more kind of automated and modernized environment that you're describing, to have real-time insights that help us support families. I want to pivot to technology, really from both of you, Katie and Liz. First, maybe starting with you, Katie Rollins. From a policy, you mentioned a lot of federal, state, local policy. Where do you see some of technology being integrated into those trends or into the initiatives that you're seeing?
Yeah. Well, federal policy has always had a guiding role in technology and child welfare. Federal reimbursement is available to support the development and maintenance of child welfare information systems, which is fundamental and is used by most jurisdictions. Under these rules, called SACWIS and then called CWIS in their updated form, historically, these rules envisioned a system that's internal to the agency, that's built largely for storing information and reporting purposes. The newer rules I mentioned, called CWIS, came out in 2016 and were implemented in 2018. They describe a system that's more attuned to promoting integration, to sharing information with partner agencies and community providers, and making referrals in between these entities. The new rules are designed to sort of promote a more modular system and to allow, for the first time, bidirectional feeds between these modules, which could be internal builds, they could be commercial, off-the-shelf software as a service. A module actually could be a partner agency system. And these rules were pre-Family First and before the shift to prevention that I talked about earlier. But never has the need for integration across systems been more fundamental than in a prevention landscape. Whereas child welfare could, to some degree, get away with an insular system in the past, when they strictly ran foster care and investigations, connection and integration is fundamental now, because they can't carry out their prevention mandate without integration with community-based providers and the partner agencies that deliver the very services that their families need. I would say more broadly, both within and even beyond child welfare, families come to the door of many agencies and many nonprofits looking for a range of supports and services that are offered across the continuum. And, as you've mentioned, a lot of these services are offered within the silo of an agency or a funding stream, and visibility can be limited and access can be limited. And families really need to be able to get access to the services they need, whether that's residential behavioral health or a nutrition subsidy or family therapy. They need to be able to access those no matter what door they come in. So with that in mind, a priority has become interoperability and integration. And as the system has shifted that way, so have the technology rules. So I would say that it's incumbent on child welfare to embrace and to really operationalize what's possible under those rules. It doesn't just mean data sharing in the old sense, whereby sort of stagnant files are exchanged periodically for administrative or research purposes, but actually creating business processes and workflows such as referrals that cut across agency systems, or between government and community provider systems, just the way Liz has been talking about, so that a nonprofit has visibility into the pool of resources available to a family, can see what's available, can seamlessly and in real time make that referral. That's really the future of human services, and the collaboration that I was talking about can't happen just through meetings. It needs to be through business processes, and business processes need technology to support and drive them. And so I think that's the direction that child welfare and many human service technologies are going.
That's very, very helpful, Katie. Thank you for bringing up, we've had technology in child welfare for a long time, but when you pivot towards a more robust strategy that is upstream and engaging a wide range of community partners, sister agencies, thinking about that prevention mandate, it does demand those additional capabilities and objectives that you described. So I really appreciate you laying that out. Liz, you mentioned a little bit, you guys do use the Unite Us platform, I know, to support referrals, but just in terms of how, again, maybe on the workflows, how you use that technology to better support families when they're walking in your door than maybe you did before, or where you'd like to use technology in the future to be able to really enable those more family-centered workflows.
So Merced County as a whole has a lot of opportunity with technology that they can change a lot with it. Right now, there's a lot of organizations that are using paper forms, and they're just, with that comes other things, like they don't always get sent, they get lost. There's personal information. For instance, doctors are screening in Merced County for ACEs. They're doing ACE and Pearl screenings. And so sometimes we get a fax in with that whole questionnaire. We're like, no, we shouldn't be seeing this child or this person's, ACE score. That's their private stuff. So we need a lot of training in that, and we have some growth to do. However, with Unite Us, I think that if all of these organizations were in there, and the fact that it is so, we see what we need to see as far as the person's profile goes. And so as families are coming in and they're getting signed up for a parenting class, and maybe their social worker said, you need a domestic violence class, or you need substance abuse treatment, and they don't know where to go, we just hop right on Unite Us and we can find it, and it's there. And we have a really great point of contact, Mercedes Carmona, who is amazing. And we literally can call her up and be like, Mercedes, can you hop on Zoom and show us how to do this? And so the support that we get with Unite Us and everything in real time is really what we're trying to share with bigger organizations. Because it would really be open to them too. And so it wouldn't just be limited to certain people who have the platform. And that's what we want to see, because we want all of our families given those wraparound services, regardless of where they're at. And so sometimes with child welfare, and they're sending them to us, they may not know all the information of where to find these points of contacts. And then we're doing that homework to find it. And the thing that helps us is Unite Us. So it'd be nice if they had it too,
Absolutely. Yeah, it's awesome. Thank you for sharing that. We've built our closed loop referral platform at Unite Us that you're referring to intentionally be able to be used by users across different sectors, so that you can have that kind of collaboration, and it doesn't have to be limited to a single organization type or entry point, because we know that's where families are: schools, resource centers, doctors' offices. So I appreciate you bringing that up. I think the technology enables the network, and the network's also really important. How do we build those networks, promote accountability, ensure that there's follow-up? I want to pivot talking about technology to my colleague Katie, who I rely on constantly. I know I work at a tech company, but I'm like the policy and government person. I need Katie when it comes to the technology part of this. But before we shift there, I want to get to Katie Rollins' point about workflows. And please, if anyone has more questions, we do have the Q&A open too as we go through these different workflows and ways that we see partners generally when we're talking to them using technology to try to modernize how they share resources with families automate some of the workflows that their workers are working on to really streamline the process. Casework is really tough. It's dealing with challenging issues with families, and then it becomes an even bigger headache sometimes when you have trouble coordinating with your colleagues and your peers across your community. And so I want to share a little bit about how these workflows can automate and streamline those processes to help caseworkers and really amplify their impact. So I'll quickly share again a few slides for the group. Starting here, and then I'm going to pass it off to Katie to walk us through how does this happen. But at the highest level, we do see some trends with partners across the country who think about trying to modernize their social care workflows. And it falls into really three that we see consistently. There's several others. There's a lot of different use cases for how to use these tools when you're trying to bring sectors together. But the first one we're going to just quickly share as an overview, something we see consistently across states who are implementing some of the initiatives that Katie Rollins spoke about earlier, upstream, kind of community-wide activation, trying to activate local resources, maybe faith-based partners or charitable resources with technology to help families navigate their needs upstream, way in advance of potential involvement with a child welfare agency. So an example could be, as described here, perhaps an individual, we've named Veronica here as a new mom, maybe struggling to maintain employment and adjusting to motherhood. She may have met a community navigator. Again, we talk about meeting people where they are, maybe at a local library or new parents class, maybe at the Family Resource Center where Liz is, and is able to be screened using a platform. Again, not a paper process, something that can be documented and then translated into a set of best fit recommendations for Liz of resources in her community that are providing services that she is not only eligible for, and we can confirm that with good information that's up to date in the platform, but also able to access, because we can send out that referral and receive follow-up from that partner. As Liz said, you're able to do it more quickly than the phone call or the walk down the street to connect with a partner, or the fax, where we have a bunch of personal information on fax and copy machines all over the world, right? So we see this a lot with community-based navigation, public health programs, child welfare prevention programs. This is about bringing community navigators and local resources together and using technology to do it in a way that's more streamlined and ultimately can track those outcomes and understand the data behind what are the needs in the community and how effectively does the community right now meet those needs. If not being met, how can we go and bring the right people on board, as Liz mentioned, to be able to meet those needs. Separate from this workflow, we do see more and more what we refer to as kind of an early intervention workflow. This might be in partnership with a child welfare system, really enabling those frontline responders with more modernized ways to share resources that are up to date and some intuitive referral pathways for families who maybe are at risk of involvement in a child welfare system. So an example here, say they're a CPS or child protective investigator, Allison, who completes an investigation. Maybe there is no sign of abuse or neglect. There's not a case open to the department, but maybe there is an identification of some need for just certain household goods, addressing those economic or other social needs. Using technology tools available through public resource directories and resource shares, that investigator can share most up-to-date information with the family via text, via email, to be able to identify the organizations that are geographically close and available to address those household needs. They can also leave Allison with a link or a QR code, leave the family with access to maybe an online form that helps that family say when needed. Again, the warm line concept. This isn't a hotline because there's abuse or neglect, but there's a path to, if you do identify additional needs, contact a public health or community-based infrastructure that can support those social needs, or at least help to send the family to the resources that are available in their community to address those needs. And we see those workflows, again, improved by up-to-date resource directories and follow-through processes with families that make sure that connections are made when they're needed, even if they're not involved in the department. And then finally, there are much more, as Katie Rollins mentioned, integrated ways using to really change standards of practice and case management workflows to enable child welfare caseworkers to do that true cross-sector coordination with their sister agencies or with community partners to be accountable for kind of managing outcomes and addressing the barriers that impact connections to services. So in an example like this one, I say there's a child who's 17 years old about to transition into adulthood from the department, working on their transition plan with their caseworker, and completes again a social needs screening, identifies the resources available to support them, and provides referrals and follow-up, enabling really that caseworker to use the platform to have those conversations via a secure chat, to be able to track the status of the referral or the service itself, as Liz was mentioning, and not wonder, oh, I hope this child that I'm working with got there. Did they get there? If they didn't get there, why didn't they? What happened? Were they unavailable? Were they not? And so again, enabling caseworkers with those insights so they can be real resources and more active in that process with children as they're in this transition. Ultimately, again, being able to track the outcome of those referrals. And there are additionally capabilities available now as well to track when services are delivered and ultimately support the community-based organizations on the other side with quickly invoicing for those services and tying their services to the payments that ultimately they can be reimbursed for using the platforms like these that bring community-based organizations together with child welfare systems. So I did want to provide these as examples to the group of how we see technology enhancing key workflows in child welfare, and finally pivot to my colleague, Katie Keating, to ask Katie, as Vice President of Solution Engineers, we call you when we're talking with partners, say, let's make the right workflow happen. Let's figure out how to use technology to support the business needs of community partners trying to support children in their communities. What are some of those key technology features that people are using and that you see there's that demand for, and people who are in our audience today could be thinking about as part of their planning?
The nice part about going last is Katie and Liz already made so many of my points for me, but I think one of the important things is thinking about how we get further upstream. So how do we make these trusted resources available to folks? Is it through a 211 or is it through setting up a warm line? And how can we make it so that, you know, a family member or a neighbor who's interested in helping also has tools and resources available to help people navigate to the programs that might be available to them? We all know that government speak is very confusing. Like, I had no idea what an EBT card was, but if you told me food stamps, I know exactly what that means. So also, how do we help someone who's being challenged really understand things in terms they understand and make it accessible, whether it's a language they speak at home or having someone who might be more sophisticated about navigating benefits, help get them connected to care. And then there is that concept of how do we make it so someone can sort of opt into maybe some more professional help? How can they say, you know, Daisha, as you said, with a QR code or a text or an email of a resource, how can I also say, I'd like to engage in maybe a little bit more formal support? And I think around that, one of the things we talk about a lot is the importance of getting someone's consent to share that information as well. So I want to be in charge of my own information, my own data, and who I share that with. And I think one of the nice things about some of the more community-focused approaches is I might have a greater deal of trust with someone I'm working with there and consent to share my information, knowing that their whole purpose is to help me and get me connected to what I'm trying to access. And once, you know, we've captured consent, how do we then help find the right resource for someone the first time? We know there's a higher likelihood of success if we connect someone to the right resource the first time. So how do we look at things like, you know, using something like a Google Maps overlay to find out, you know, where is there a bus stop near a location that you want to avail yourself of so that you only have to use one bus pass instead of having to, you know, pay for a transfer? Or if I'm already going to work or my kid's school, how can I find a location that is convenient for me to access? And then for some of those harder to find resources, how can we do things like in Unite Us, we do what we call a bulk referral, right? So I can send that referral out to a number of organizations who are a good fit for me. And then, Liz said she only has 4 staff, right? So as she's busy like working with all those people in front of her, in the background, those referral requests are going out to organizations who can evaluate them and see if they have the ability and capacity to serve it, and then pick it up to work with it, so that Liz can keep working with the people in front of her, and in the background, the technology can help get connected to really folks who have the ability to serve at that point in time. And then when I think about sort of the folks we serve, we're really interested in also being person-centered and trauma-informed. So how do we make it so if we do a screening, it can be shared in that care team, so we only have to ask those questions once. We want to make it so that, again, if that person's consented to share their information within their care team, people can see what's going on and can think about what the right action is for that person, and they can really take that team-based approach. And then I know sort of as we get into case management and more into child welfare and maybe, not being an opt-out process, I think a lot about how child welfare and CWIS require sort of the auditing of what's happening. So a lot of times there's a court process involved as well, and people love to know what day did that happen, what time did that happen. So timestamps for things like communication and knowing when a referral was sent and when someone was able to engage in services. We know there's a lot of timelines in child welfare, and that helps us understand how we're doing against those timelines as well. And most importantly, I think it's important that people capture outcomes as well. We think about, identification of problems and the interventions that happen, but what are the outcomes of those interventions? And I think there's 2 ways we think about that. One is it's very important to track outcomes so we know sort of what the services are that are having the most positive impact. But when I think about it from a state or a federal leadership perspective, when I think about the work Katie's doing about, influencing policy, how do we think about that data and the outcomes when we think about program design? So are we able to make, data-driven decisions about what programs might be missing in our community, or, where we might need to go get funding to stand up a new program if we don't have capacity?
It's really helpful. And on the topic of data and data insights, Katie, can you talk briefly? I know we're near time, so this might be our last question, but before we open it, but how do our partners use some of this data in their work? I think that's it's a new set of insights that you're talking about, process timelines, outcomes of services. What does it look like when you're talking to clients?
I think about data from 2 very different perspectives. So before I came to Unite Us, I was really used to working in siloed systems, right? Where there was one source of data and one set of people you were reporting to. And one of the things that I really appreciate about our shared infrastructure is the fact that, analytics and insights are available to everybody. So if we are talking about a community need, Liz does not have to go convince 8 people with 8 different sets of data what is needed. Everyone can have a look at the data at the same time. So again, when we think about programs or where we might need funding, there's the ability to evaluate that where everyone is working from the same set of information. And then I really think about that in terms of like community capacity. So, how can we look at community needs and also, programs that we might need to initiate? And then I think really about the importance of that shared infrastructure and being able to do real-time evaluation. So, Daisha, I know you mentioned it very quickly at the beginning, but in North Carolina, there are academic institutions doing real-time evaluation of the data that's being collected through their Medicaid waiver. And that's because all of that data is available in one platform to be able to see that. And so I think, when we think about data silos and data sharing agreements and all of sort of the legal and technical work that goes into, sometimes creating interoperability, if you're going to focus on, getting people connected to the programs they need, and you want to work either between agencies that might be under the same state umbrella or between the community and education and also, child welfare, having a platform that allows that data to be shared across that care team where, people don't need access to all of those state systems that they're mandated not to be in, but a way to still understand holistically how they can better serve that child or family.
So helpful. I started at the top saying we can center families in their journeys and find ways to share important insights in that process while still acknowledging the importance of maintaining different systems. So thank you, Katie, for sharing that. I want to go back to Katie Rollins and Liz. We have just a few minutes left. Any final comments from either of you, having heard Katie, or things that have been discussed on the panel? And then I regret we'll probably have to close up, and we'll keep this conversation going in other ways. Katie, anything else? I saw you came off mute. Okay.
No, I
Awesome.
don't have anything further. Thank you.
Awesome. Okay. Well, thank you everybody for joining us today. I'm leaving with a lot of enthusiasm and appreciation, Liz, for the work that you're doing on the ground every day. For Katie and I, it's really motivating to hear around the range of things you deal with, so that we can think about how to provide solutions that are helpful. And Katie Rollins, you really have consistently helped us think through how some of these shifts and trends at the macro and micro level may benefit from different types of technology support as well today. So I really appreciate your inputs, everybody, and hope our audience can please stay in touch. Let us know if we can help, and have a great day.
Thank you.